They told you it was something dirty, something private, shameful, something you should have grown out of. Because what most men don't realize is this: it's not disease that's robbing them of joy. It's disconnection, it's silence, it's the lies they were taught about their own bodies. In the next few minutes, I'm going to give you 7 truths. Yes, 7 uncomfortable, powerful, science-backed truths that could transform the next decade of your life. But before we begin, if you're a man over 60 or someone who cares about one, subscribe and turn on the bell so you never miss another honest, unapologetic conversation about your health. I've had patient after patient sit in my office, head lowered, voice quiet. "Doc, I still do it, but it doesn't feel the same. I can't finish unless I use a certain video, a certain hand, a certain way." Or the hardest one to hear: "It's like my body forgot how to feel." What they didn't know was this: they had trained their body, trained their brain into dysfunction, rushed, disconnected, tense, mechanical. Every stroke, every image, every habit burned into the nervous system. Over time, sensitivity plummets, response weakens, and intimacy, real intimacy, becomes nearly impossible. This is not harmless. It's neurological conditioning. The same way muscles remember movement, your arousal patterns remember stimulation. If all your pleasure is fast, artificial, and one note, your body forgets how to respond to anything else. That's when erectile dysfunction creeps in, when touch feels numb, when connection becomes foreign, and men begin to feel like ghosts in their own skin. The body isn't broken. It's just been taught the wrong thing, but it can unlearn. A man I'll call Richard came to me at 68, up 5 or 6 times a night, dull ache in the pelvis. He thought it was just aging. But when I asked, "When was the last time you ejaculated?" he looked stunned. "I haven't since my wife died, years ago." I get it, but here's what Richard and most men don't know. The prostate doesn't stop producing fluid when you stop ejaculating. That fluid builds up, it stagnates and, well, causes congestion. And congested tissue becomes inflamed, swollen, painful. It presses on your bladder, affects your stream, wakes you up at night. Worse, chronic inflammation in the prostate is linked to higher risk of prostate cancer. This isn't myth, it's data. A Harvard study tracking 30,000 men showed that those who ejaculated 21 times a month had a significantly lower risk of prostate cancer. I'm not saying lack of ejaculation causes cancer, but I am saying frequent release helps prevent the environment in which cancer can grow. So Richard started again, not out of lust, but out of care. And slowly, he came back to life. His body eased, his nights grew restful, and something in his eyes changed. He remembered he was still here. Most men didn't stop because they wanted to. They stopped because someone, sometime, taught them it was wrong, dirty, immature, unholy. But shame isn't harmless. Shame is stress, and stress is inflammation. It tightens your chest, it raises your cortisol, it steals your sleep, it robs your mind. Healthy touch, yes, even solo touch, lowers cortisol, raises dopamine, releases oxytocin, improves mood, improves memory, improves sleep. I once worked with a 72-year-old man, recently divorced. He was numb, low, silent. No sexual contact in over a decade, no intimacy with himself or anyone else. We didn't prescribe pills. We didn't rush him into performance. We just gave him permission to touch, to feel, to remember he was alive. Within weeks, he laughed again. He stood taller. He started living. That's what shame takes away. There's this idea that testosterone just drops, like the battery slowly draining, but the truth? Testosterone listens. We didn't pump him with hormones. We re-engaged his body, breath, movement, gentle self-touch. No porn, no rush, just presence. In 3 months, his testosterone rose. He stood straighter. He started lifting again. He felt like a man again, not because of age, but because he returned to himself. I've heard men say, if I'm not having sex, why would I need an erection? Well, the simple answer, because erectile function is actually a vital sign. It's a reflection of your blood flow, your vascular system, and your heart health. And when you go months or even years without one, the system starts to shut down. Elastic tissue hardens, nitric oxide fades, blood vessels stiffen, and sensitivity really drops. Let's talk about porn for a moment. I'm not here to moralize, honestly. I'm here to warn you. What porn does today isn't what it did in the 1970s or 80s. Today's digital content is fast, high-def, extreme. It absolutely floods your brain with dopamine. And when dopamine hits too hard, too fast, and too often, that's not your fault. But it is your responsibility to reclaim your sensitivity. Take 30 days off. Rebuild your arousal. Give your nervous system a chance to reset. It's not about giving up pleasure. It's about, getting it back. There's something, more dangerous than all the rest. Loneliness. Oxytocin plummets, your immune system weakens, your nervous system downshifts. Your sense of meaning begins to vanish. Peter, 76, once told me he hadn't felt another person's touch in over a year. Not a handshake, not a hug. That's not aging, that's emotional malnutrition. And when you stop touching yourself, you abandon the last connection you have. But you can come back. You can reclaim this moment, this breath, this skin, this life. So here's what I tell every man who's ready to return. Start small, 10 minutes each day, no screen, no pressure, no goal, just presence, breath, and gentle, intentional touch. Your body remembers, your spirit remembers, and when you honor it, not with shame but with care, you come alive again. You're not too old, you're not broken, you're not done, you're still here. And what you do with this moment matters. Subscribe if you haven't already. Type 1 in the comments if you're with me. And share this video with a man who needs to remember that he's still alive. Because the truth is this, masturbation isn't about sex, it's about sovereignty, and it might just save your life.